Okay. Hi, everyone. Thank you so much for joining. For those of you that don't know me, my name is Rubina, and I'm with the academic recruiting team. Aspen Dental is a dental support organization. We have roughly 800 plus offices across the US. And so I work for ADMI. So we're the support organization for Aspen Dental. And we're here to support doctors just like Dr. Gray in doing what they do best, which is focusing on patients, clinical care, and everything dental. So before we begin, I just wanted to let you know that there's a question and answer box on the bottom of the screen. So feel free to type in whatever questions you might have. I also have some questions you submitted prior to over here on this screen. So if I'm looking over here, it's because I'm just referencing that there's no one there. It's just me. So I'll just be the moderator. And if you do have some questions that you want to ask privately, you can totally put those as anonymous and or email me if you'd like. But I know today we do have the incentive of whomever asks the most questions will get some prizes, and I will announce that at the end. Um, so before we start, I will have Dr. Mark Gray introduce himself, and then we'll begin with all the questions.
Okay, well, hi guys. As she said, I'm Dr. Mark Gray, and I also attended WVU Dental School, and I've always been a West Virginian. Um, and undergrad, actually, it was funny because somebody just asked where I went to undergrad in this little question box. I went to Fairmont State and was a biology major, and just went right on to becoming going to dental school, and then I went right into private practice and actually co-owning a practice out of school. So I was an associate and a co-owner for a while. Then I dropped back down to just being an associate, and then because I got out of co-owning, but then I joined Aspen here in about August. I think it was August 2020. So here I am.
Awesome. So I guess like right off the bat, what made you join Aspen?
Obviously, as anyone is going through things, I was looking for employment at the time because I just was looking for something new. And then whenever I applied, and I was honestly a little skeptical because there's a kind of a bad vibe with corporate dentistry um, and with a lot of private practice dentists. But I just decided that after I met with Dr. Cost, which is my POP or owner, if for anybody that doesn't know what that means, like the owner of the practice, it seemed like a pretty good fit. And I was still kind of skeptical, but then, I mean, I talked more and more. I talked to him about the support of Aspen and how things kind of work. Um, I just thought it was just the right fit, honestly, because I've done it, but because I did the other way. So I was like, and it was also very, very tough. So I was like, well, maybe this will be the right fit for me.
Wonderful. So someone just asked actually with choosing Aspen, what makes Aspen more advantageous than other DSOs when you were looking at possible job opportunities?
Um, as DSO as in another
Like corporate.
corporate. That's what I figured they were
Yeah.
asking. I just don't ever think of it called like that. Just I think in the area because there's not as many in my area, and obviously I'm working in West Virginia, and that's where I wanted to go. And it's just one of the ones that I mean I also had applied for other jobs at the time, but then I talked to other private practices and I just thought that the with the corporate, I mean, how they support you and how you also, I mean, it's things that you kind of get with Aspen as in, I mean, insurance. I mean, that's like one like big thing, and like potentially growth as retirement and things like that. That's like not a normal thing in private practice. So it's like I finally, wanted to start thinking about the future instead of just like right now. So
Awesome. Um, were you skeptical about corporate dentistry? Is that why you avoided it at first? Are there certain stereotypes? And are you able to debunk any?
I think that there are some stereotypes about corporate dentistry that like it's just about about money, and I found that it's like actually completely different. than um, that. With my POP, because I feel that what some people don't understand is not just Aspen. Like that, we have POPs which are owners, and they provide the opportunity to have like a network of offices, and that's what we have. And so we kind of have a support group within Aspen, and then we also have Aspen. But there's things that like standard of care, which is very preached high in dental school, which is what you're supposed to do. But sometimes when you get into private practice, like not all patients want to like just go with everything that is, you know, the standard of care because they can't afford it or things. And but I think that Aspen actually provides a like with the like some financing and like other ways to um, get everything done. It gives you the way to actually be able to provide the proper care instead of just like skating by and like patching stuff up or like doing not I don't think the greatest sometimes not the greatest work.
Definitely. Thank you for that. So um, I had a question asked earlier. It was submitted earlier. When you came out of dental school, what were your options and what advice would you give to a dental student preparing coming out of dental school, especially, all of their fears with treatment plans, speed, all of that good
Mm,
stuff.
Um, I think well the options coming out. I mean, you can there. I mean, sometimes you're going to be able to find like a private practice that you can find an older dentist or someone usually more experienced because they own a practice that you can jump into that. Or Aspen gives you a very good it's a very same style as giving support to the associates coming out. I mean, I have an associate that's right out of school, and while I'm only 5 years experienced, in 5 years you learn a lot. And I just and as for speed and things like that, or like work like fears, I mean, this is practice. And then it's a practice of dentistry. So like I think the fear thing or like the worry, it's good to have, but also like you really just have to like try to do your as long as you always do your best work that you feel that you're doing, then I feel that you really I mean that's all you really can do. I mean if you do what you think's the best and the standard of care, then um but then to speed, obviously when you guys come out, you're not going to be up to the speed of like myself or even like older dentists older than I am that are probably like faster than I am. But like but it'll come with time. Like even I've seen my associate grow so quickly, and she's went from taking a good amount of time to moving right through things. And I think that she could even if she was I mean if she was speaking, I don't want to speak for her, that she's felt like she's learned a great deal in just a few months being out of school.
Talking about that, having an associate under you and everything, and kind of you being the mentor doctor, do you see that, when associates start that they're able to begin at a slower pace and then gradually move up, or does Aspen, regulate on their pace and their treatment plan type
Our
and all that?
I 100% feel that like for Aspen we give the complete support of the associate even with because I've been in training with well because we obviously have bigger trainings than some people, and we've been in trainings with other associates from even different parts of the country, and the other MCDs and other dentists. And I mean the main thing is like we don't want anyone to ever feel rushed. Like if you feel that you're not going to do a good job, then don't rush yourself. Just take your time, and we'll get done when we get done. And I mean, and then there's always time for another appointment to get whatever else we need done. I mean, it, the priority is like the patient care and the the quality of care.
So it's not like quotas and making sure.
I
uh,
mean, there's no quota. There's no one like it's just. I mean, if you give quality patient care
right.
and give people the standard of care what they need as well, then they're going to get. I mean, it's one of those things that it kind of comes with if you do the right thing. Then I mean, a you're going to be doing the proper treatment that actually sometimes that it maybe cost more, which is maybe the proper treatment. Or if you're doing the proper treatment, treating the patient properly, I think they end up recognizing that when you like if you just explain things to them properly, and then that like builds relationships and the patients come back, and that's also how you build a practice. And I mean, I hate to say it, like not like hit a quota, or because there's no quota, but like how you make money. I mean, just the way it is.
Right. So that stigma of that there's someone at like corporate or someone up there that's like watching your bottom line and all that kind of stuff. It's
I
not.
don't think there's I mean I mean we I think our budget and our profits are monitored, and I have a regional manager, and she is there like, and I'm the MCD. I don't know if they understand what that is. Like, I'm the managing clinical director, so I'm just in charge of my practice. And she's there, but like we are very like more like she's my regional, but like we're more like peers almost. At the point is she's just trying to help me manage the practice the best way we can to make it more productive, and she's not there to like threaten me with like negative thoughts or anything. It's just like, what can we do to make this better? Because there's always a way to make it better, whether it be scheduling or like, time management. There's things, I mean, or even employee management. I mean, there's many factors that go into practice, and it's more like I feel like it's just extra support versus me just having to run it all myself, which I've had to do that as well. So I mean, it's just kind of a nice extra support mechanism, I guess.
No, totally. So I just had a few questions asked via text. That does help. So what changes did you make when you switched from private practice to Aspen, like as in your like responsibilities and things like that?
Um, I think that whenever I switch from private practice to Aspen is one of the things that I don't have to um, deal with talking about as much is the financing. I mean, that's one of the things that we have a dynamic of. I'm the clinical director, and I mean, as far as it goes, I'm still in charge of my entire place. But I have a front office that's very skilled and trained to take care of talking to patients about like finances and money. So it kind of enables us to be like, this is actually like the standard of care that we want to give you. We're not going to just, I mean, for example, we're not going to just give you a regular cleaning if you need a scaling root planing, et cetera, et cetera. And or like we're not going to put a giant filling in if you need a crown. And we give them the best care that we think that we can give them, and then they can go up, and then and once we explain it to them, they usually are very receptive, and they get to talk to our office manager about financing and things like that. And in private practice, it's more like as soon as like you talk to a patient about what their care is, it's like you're kind of also in charge of getting them to not pay for it, but like talking to them about finances and what they can do. And it's one of those things that's kind of like been a relief to not have to do that and just be like, and just be able to give the best care I possibly can give. So, I mean,
Yeah. No, that's awesome. And you know what? I meant to go back to what you were talking about being an MCD versus an associate. Can you elaborate a little bit more on what those differences are for dental students and if they're interested in Aspen, like what that means if they graduate and coming into Aspen and Aspen practice?
as an associate, you really, you're coming in and you're a practicing dentist, but you're not expected to have completely expanded skills as someone that would have been practiced for a while. And as an MCD, you kind of also how do I put this? I mean, basically, obviously, you have more expanded skills, but also I deal with managing like my associate and also like my dental assistants and my front office, like to an extent, and like basically in my lab techs, like I kind of like touch on all the bases of the office while my associate just gets to come in and she's practicing dentistry and she just gets to be a dentist, which is, I mean, and I've got to do that before and it's great. It's like stresses you don't have to deal with. But in the flip side of that is you get a bigger incentive to be an MCD after you're, to that level, because there are, and because we have a daily rate and I get paid a certain amount of money. And then if the practice does well enough, then I make more money based off of a profit sharing. And I get the profit sharing first before an associate would get that because that's just my spot in the practice. And due to my additional responsibilities, I get it first.
Thank you. Thank you for that. Um, so for people like just elaborate with what Dr. Gray had said, MCDs, they're almost like in charge of the office too, I would say, because like when Dr. Cost, your POP, who's
Mhm.
the owner of like his practices, which are multiple, usually it's not just one, it's multiple practices. When he's not at that practice, he's relying on Dr. Gray to be that leader and take over those responsibilities. If there's any kind of, issues with the back and the receptionists, the front desk, or, the managers, he's there to kind of alleviate those issues.
There's still, that's why managing's in my title. There's still
Yeah,
managing going. It's not, I'm not just doing dentistry. That's
right.
dealing with personalities and helping people get along. And sometimes it's a little dramatic and a little messy, but it's still there's a little extra with that. And as far as like, and I'm managing there, and fortunately I have a POP or owner that's very trusting in me being there. Like if I need anything, he's got me. But um, he, as far as that goes, he's like, I'm in charge, and it's my practice to run the way I feel. So, which
Right.
is very nice as well.
Definitely. And so, with that, are you able to choose who you want to work with? Like when it comes to like hygiene, dental assistants, do you have hiring power, or do you work with Dr. Cost, your POP on that kind of
Uh,
stuff?
I'm not sure what do you mean exactly.
So like, let's say you didn't have a dental assistant, you guys were in need of one. Would you be part of the interviewing process, or have you not experienced that yet?
Yeah, I am. My office manager actually does a really good job with hiring. So I trust her very well, or very much, I should say.
Okay.
Um, she does very well doing that. But she consults me, like I'm like kind of the final say with everything, which is the nice thing is, I mean, and that's kind of the way that the hierarchy of the office is. While she's in charge of the office as well, like kind of my say is kind of the final say, and she does consult me for, I mean, dental assistant positions, or if we need a hygienist or lab techs or et cetera. But
Awesome. Cool. So let's see, what are the questions I have? I have some via text, via email, via this, via everything. So someone just texted me, going through dental school, did you want to do private practice and then you realized it wasn't for you? Or was that your only option at the time? Like you had mentioned, there weren't many options in West Virginia. What was
um,
your
I just was kind of trying to figure out my way, and it seemed like going to private practice was the only option as an associate. So that's kind of just the way I went, and then I kind of fell back into my hometown, which also wasn't a plan at all. Like I also, like I always talked about moving away and things, but sometimes you just go where the job is, and then I did that for a while, and it was really, I mean, it really wasn't a bad experience for me to do that either. But I just, after I've done that, and I've co-owned and I've managed that way, and I had to manage financial things and practices, and I don't know. Aspen's just a very it's very different than that situation. But I feel that now being here, I have never enjoyed doing my job more. Honestly, and I can say that without like, I'm not like just saying that because I work for. I literally love my job every day I go to work.
Why do you
So
say that?
it's just the people and the environment and sport. I feel um, I don't know. It's just a very different. It's very different than private practice because, and also, I don't know. There's a little bit. I mean, there's some things that you come out of school, and there's a lot of practices are like production driven of you trying to make money and things, and it kind of skews your thoughts about what you have to do to do dentistry. And I just don't feel those pressures. I mean, doing my job. So
That's awesome. So do you feel like there's a work-life balance? How is it? Someone asked that, how's the work-life balance at Aspen Dental?
I think it's better than any other thing that I've ever done. I mean, uh,
Awesome.
I have a good relationship with all my employees. Actually, I mean, we, with all the weather and things that were going on, we just started. There's a group chat with everybody, like a text thread, because of we were worried about people coming in and things last week. And we have a very good like vibe there with the office, and everybody's, it's a very great relationship. I feel like that we all have together, and it's kind of like of a family relationship. And I feel like that's how it is in many practices um, within Aspen.
Yeah.
But the balance, I mean, I get off at 5 o'clock, and while I have to take call if somebody's like we do have an emergency line. So if somebody has an emergency, then I mean I will take it and like call them or whatever. But like I'm done at 5 and I get to go home and I don't have to worry about if my like I don't know how much we exact not completely, but worrying about paying the bills for the practice and things that you would have to deal with in private practice. So
For sure, for sure. So I'm going to focus on a little bit more of like Aspen Dental questions since we're kind of going along with that.
sure.
Someone asked, what do you feel Aspen Dental does well? And what do you think they could improve on? You can be honest. No one's
Um,
gonna reprimand you for that.
no, I mean I think that we provide treatment to those that sometimes couldn't afford it otherwise because we have a range of like options for dentures and things, which not every practice does. Um, we really do. I mean, there's just different levels that we can provide for people, and also we do a lot of oral surgery in the office, which helps people with the not having to go and get all their teeth out of oral surgeon every single time that they need a tooth out. Um, and I mean, just and honestly, to get just providing quality and standard of care. Um, what we can improve on, that I feel like sometimes that's the harder question. Um, Sometimes, I mean, but I mean, this is like what's basically with any job. I mean, just the communication with my RM or like my like just trying to like find information out on certain things that's going on because we have training within the organization and things. And sometimes I feel like I can't get an answer from somebody, and it takes a little time because it's a little bigger organization versus just like talking to somebody within an office. So that's like a little like thing, a hurdle that sometimes we go over. And I know another hurdle sometimes is we've had there's been times where dental assistants are they say it like it's kind of a revolving door sometimes because I mean just it's a very upbeat but like very fast paced place and sometimes not everybody's the best fit. So like it's just just certain things. I don't know.
Right. No, totally. So going along with, being the best fit, how can one improve their chances of being hired at Aspen Dental, especially being a fourth year, looking for possibilities?
I think that something I would suggest. I mean, not that this is like a number one suggestion, but we do a lot of oral surgery, and that's like I feel that you should like try to have a little extra um, experience doing that and just try to diversify a little bit. But when you come out of school, there's no one's going to come like if you are trying to apply, if you don't want to do molar root canals, no one's going to expect you to do molar root canals. Like they're going to understand that you're you still need to grow. And honestly, the time for you to grow is going to be coming whenever you get out of school because when you come out of school, it's not you they say that they get us by just like enough to practice with the board testing and everything. And that's kind of the truth, unless you like make what you make of your, your dental education and like how much you actually do there. But like no one's expecting you to be like a rock star when you come out. Like they just want you to be able to, do things and, be able to maybe think about managing time a little bit. But I mean, there's not, I don't think one specific thing that's going to make Aspen don't want to hire you more.
No, definitely. No, thank you for that. Do you feel as though like did you interview your associate or was she hired on?
She was hired before. She was actually hired before I was hired,
Oh,
uh,
okay. Okay.
which was so strange. Like because we were almost hired simultaneously, but I mean, she was like it was like a day before I was hired. So, but she was coming out of school, and obviously she and whenever you come to interview for Aspen Dental, like the thoughts are like, what is your aspirations going to be? Like some people want to become a dentist and only want to be an associate dentist. They don't want to deal with the management like portion of anything. So I mean, if that's what your aspiration coming out of school is to be an associate and be like support for like the managing like the MCD and like take like be able to see new patients and do different things, but like not have to do everything. Like that's an okay like plan as well. Like that's okay.
Totally, totally. Um, with Aspen, let me see a couple questions. Okay, I guess this is like another stigma kind of question people assume. So at Aspen, are you paid per procedure
So
or
saw
your
that
paid
one on the
rate?
side. I get a daily rate, which
Okay.
is just that's the I mean, and you don't have so that's the thing where you don't have to. That's what I was like kind of like alluding to earlier is whenever you are on a commission basis, not that it changes anything, but like if you're working at a private practice and you're on a commission basis and all your patients cancel, um, you don't make any money, and that's kind of stressful when you have bills to pay. I mean, that's a thing. I mean, that's for anybody in life, and I mean, that's at least the smallest thing that like Aspen can take away from you is like the stress of being like, well, it snowed 6 inches and we had half our schedule fall off, but I mean, everybody's still going to get paid and we're still going to survive, and it's not. It's just like one of those things. It's just one little less stress to have to deal with.
Yeah, for sure. Um, you know, with that, do you get to pick out your materials? Is that taken out of your pay? How does that work?
Um, Materials. I mean, I get to select. I mean, I let my associate pretty much if she wants to get something or she can get something. We're pretty. I'm pretty lenient on the idea of getting materials or like ordering things because if you need it, you need it. It's just one of those things that you have to do for dentistry. And I've practiced with places where they like think they need to like pinch pennies with materials. That's just not the way to do it. Like if you need gloves, you need gloves. If you need composite, you need composite. Like if it's something that's going to make her feel better to have something, I'm going to like, let her have it. Like it's not a big deal. And the only thing that at the end of the day, that where it comes in the back end, if it does like affect how much the practice makes each month, and that kind of comes back to the profit sharing things. And if it was less costly, but I've never had materials be a cost like an issue at all ever. So
Right. And a huge thing is we're a big, affiliate and, a big customer of Henry Schein. So we're number two to their like largest customer, and the largest one is the US government. So we're number two. So we get everything, like especially with the whole COVID, with PPE and everything, we were able to get an abundance to the point where we are like donating to local hospitals and medical centers and everything because we just have that access because we are one of their largest customers, which is pretty cool. So with that, we get really good discounts and just good deals with a lot of their products. So I have a lot of questions about lab. How is your compensation structured when it comes to having lab bills? Do you have the freedom to choose which kind of labs? And I know maybe you could talk about how we actually have a lab within our offices.
yeah. So as far as that goes, removable labs, we actually have a removable lab on site in the office all the time, which is fantastic because like of like getting things done same day, or I mean, in general, like if I need something specifically done or if I have a request for my lab tech, which I'm sure I ask for too much all the time, and she probably like hates me all the time. But it is fantastic because I mean, I can walk back and talk to my lab tech about how I want something made or like what she thinks about something because they know a lot about this too because they're the ones making the dentures. Like they know. As far as like for dentures, otherwise, like the only thing we send out is metal frameworks, is which, and we have specific. We have for metal frameworks, and then for Crown and Bridge, we have like preferred labs that Aspen would like us to use. But I mean, like one of them is like Night Dental, which is like one of the largest labs in the United States, which I used before I came to Aspen some anyway. So it's not like we're using this specific Aspen labs whenever it comes to certain things like that. But it is very very nice to have an on-site lab, and we can provide things like if like somebody broke a tooth out of their denture this morning, and I just walked back and talked to my lab tech, and she said, I'm like, well, how much time do you want? And she said, well, give me an hour. And I said, okay. And then someone got to have their denture back in an hour versus like who knows how long if we had to send it out. So it's just kind of a nice little extra thing to have.
So it's that easy. So like I know like there's always I every time I do these, like a lot of fourth years, third years, with their experience with dentures and removables, all that stuff, they're so fearful with dealing with dentures every single day. Is it much easier after graduating and also having the access of a lab within your
I think
office?
it's helpful for having lab in your office, but I also think that, I mean, I know as my practice, and the month of November was number 3 in producing dentures in the United States in Aspen.
Wow.
So we make so, and and if this is I mean, it's a West Virginia based thing. We're the second most dental state, so we make a lot of dentures. And I know all the MCDs and all the dentists within our um, um, under our POP and everything, we're all pretty experienced with dentures. And but like if there's any questions or anything, like my associate was not completely like there's some things that like I've helped her with, like we've talked about and things like that. But like there's a support there between your MCD or your lab tech, like because they have a lot of experience. I mean, they can chime in or they can come into the room with you, and sometimes you're like, hey, this is what I want, and it kind of makes a big difference sometimes.
Right. No, that's awesome. Um, Now, with joining Aspen, did you have a non-compete? 'Cause it's a big question when you're about to graduate. Did you have a non-compete where you can't practice around the area? If you leave them, and if so, is that something you were aware of when you signed on?
Um, I I do not have just a specific non-compete with working there at all. We don't really have it's a contract, so to speak, I guess, but like it's more of an agreement that
Right.
we go to work. It's not like there are contracts more in private practice because people are trying to protect themselves, I mean, which is fine. They have to do that because it's small business, whatever. But because smaller dentists or like smaller practice, they're worried or fearful that you might open up next door. So, but with Aspen, that's like not, we're not. I didn't have any of that pressure or anything. So,
Yeah, yeah, it's across the board. If anyone's asking, it's not just Dr. Gray. We only have letters of agreement, so they're about like 2 to 3 pages about, where you're going to work, who
and
the
I
owner is.
and I can if I can chime in,
Yeah, go ahead. Yeah.
if you work in private practice, and I mean, private practice is great. I mean, it's fun. If that's for you, that's great. But in private practice, you may encounter, which I have, an issue with like trying to figure out working somewhere because of a non-compete, and like dealing with getting like it getting dissolved and things. So just things to think about. That's all.
No, for sure, for sure. Yeah. So there's no competition. You can literally open up right next door if you'd like. We obviously would like a few weeks notice, maybe a month or two, just because you guys are more specialized than the average worker where you can give 2 weeks. So, but other than that, there's really no radius restrictions or anything like that, which is pretty awesome. Because we're that confident that you'll enjoy working with us. But um, so let's see. I had someone ask, I know you started after COVID began, and COVID impacted private practices greatly, and the owners are still responsible for all their workers. How did that work with Aspen with when COVID hit? Would you still have been responsible for all the workers' salary during shutdown? Or, I mean, do you know about that kind of stuff?
I wasn't. I kind of started after, but I think that, I mean, in private practice, you're not necessarily completely responsible for it either. I mean, they could have um, just laid their workers off as well. I mean, I don't know, and I don't know exactly what the. I think the Aspen tried to keep people as long as possible as well, unless until the point where it was. But I can't speak for that exactly, so don't quote me on that. But but I know. I mean, there were some people like I mean, I was working at private practice and got laid off for during the time that during COVID. So like I don't think that was an unusual practice. I don't think for any practice, whether it be Aspen or private practice or anywhere really.
Definitely. Yeah. So did you feel though, like after you started with Aspen, there were any changes with COVID and your limitations on work or less patients? Did you feel less busy or?
I don't think that I've ever felt non-busy since I've started. But when I started in August, it was a few months out of removed. But with Aspen, I honestly, it was the middle of October, November, like that one month that I said that we did a lot of dentures, and I was like, I don't know, I can't believe because COVID was still like a real thing, and like people were still just coming on in. They wanted to get their stuff done. So I don't know what was going on, but like they're still coming.
Definitely. Um, so can you speak a little bit about the technology in the office? The iTero or,
Sure.
what do you have
Well,
going?
that is one of my favorite things in the world is never having to take a PBS impression ever again. Well, not ever again, but like with Crown and Bridge because it just saves so much time and my crowns and things like that fit so much better and it makes things so much easier if you, which I am in like an Invisalign provider as well. So that makes things super duper easy because you can just look at a scan and see if you need to fix something or things like that. Versus if there's times where if you take impressions and if it's not right, you just got to keep doing it over and over again, which a saves time, but it's just also honestly it's one of those things it's like just like nice and cool to have like good technology. It's like it's kind of like like a dentist, like it's like you're like being at Christmas a little bit, like, you know what I mean, when you get like new technology. And we just got a CBCT in office so we can take 3D scans of people, and just got trained in how to like trace the inferior alveolar nerve and things like that so we can plan for implants. And I feel like we have a pretty good support in technology, honestly. Like,
Awesome. So going along with, being trained in all those kind of things, and you talked about Invisalign, what are the opportunities you're given with CEs and dental education, furthering your education? How does that work?
I think that um, okay. Ask me that one more time.
Just like with CEs, like how does that work with Aspen Dental and furthering?
Well, I mean, Aspen has active training all the time, which is one thing. Not that this is not an improvement thing, but we get extra training all the time,
Right.
and um, and there's, I mean, they make sure that we stay up on top of like all those things and all the trainings and all the things that you're required to get every year. And but it's and most of it we get most of our training. I mean, we don't have to pay for a lot of our CE because it's just within our company, and it kind of takes care of all like dealing with all those issues of finding CE courses and traveling. While that's still fun to do because I've still done that too, not so much with COVID, but it is nice to have just it available to you pretty much at any time because we have a, and I just literally got an email earlier. I think it just like tells us what CEs are available every week or what interactive CEs coming up or things like that versus, and you get those from like different dental organizations and things, but um I mean we have as much support with that as of anyone, I'd say.
That's awesome. That's awesome. And if you wanted to go outside of what we provide, what are like the options? Have you experienced that? Have you,
Like for CE,
yeah, received?
oh yeah, I mean like there's like the Academy of General Dentistry or like the ADA, they all provide like these things, which which is pre-COVID. It's a very enjoyable thing to get together with your peers and do things like that as well. Um, but I've also never experienced. I'm assuming that Aspen has like CE courses where we have, which it's actually called. I'm sorry, I do remember this now, but I've just never had to do it. Like lift training,
Right.
where we have CE where we all get together as Aspen and like learn things like Invisalign or oh, there was something else, but I can't remember off the top of my head. Where
Like
they usually,
implants, I think
yeah,
implants. They use.
implant like implant courses and things like that, where we get together and like there's you know like dinners and things
Yeah.
that go along with just going to your CEs and just like interacting and socializing and just enjoying yourself.
Right. So going along with that, like interacting and socializing, I know it's super hard with COVID. Obviously, you're not getting to meet like all your other peers at Aspen Dental and engaging that huge network. But how is it with interacting with your POP, or had you been an associate, like the doctor that's working in your office as well? How is it for her? How is it for you, with her, seeing you as a mentor and you talking to your mentor or your POP? Are they easily accessible? Is it easy for like a new grad to have that access, to someone to speak to while they're treatment planning or just going through their beginning stages
Yeah.
of
I
being a
mean,
dentist.
yeah, I understand. Me and my associate talk every single day. We talk about treatment planning every single day. We talk about like different situations every single day. This is something that like I've highly encouraged her to ask me about because just because I have experience, and I'm like I like there's nothing that's like going to be a bad question or anything because I'm like, and sometimes I'm not going to know the answer either, and we're like we'll have to figure it out together and like just think of what the best, especially treatment planning because you get in treatment planning sometimes and it's very convoluted and deep and like a lot of things going on and there's and her way might not be like what I think but like sometimes it still works and it's one of those things and that we talk about constantly but then as far as my my pop I have him at the literally on speed dial if I need to like talk to him and usually and if he's practicing too but like if I need to talk I mean I he we can get to each other through we have like a private texting thing um, our offices so all the doctors can talk to each other at the same time
Awesome.
about certain situations so it's everything's encrypted and everything that we talk about is like obviously not in the public um, and then but I mean I could call him like at any time and get advice or help or anything I needed so
That's so awesome. That's so you always have like almost always have access to someone to help you out.
I mean I have him but then also we literally have I mean I think it's like we have 10 or 12 doctors on a thread that we can talk to each other on. Not many people have 10. I mean, you have school, like you have your friends in school that you still like maybe like talk to some after. And some people like to talk to each other a lot more than others. But I mean, it's not many people get to have like, if you see something strange or like need advice or like want to talk about something or just like want to tell each other Merry Christmas or whatever you want to
Right.
say, just to like be able to talk to 10 or 12 doctors, at once. So,
Definitely. No, that's awesome. Um, Now, within your office and just like the Aspen Dental Network, do you have specialty practices that Aspen has, or are there specialists that come to the office? How do you refer out? How does that all work?
I mean, I think that's preference for me. And right now, we don't have anybody that comes in the office. There are offices within Aspen that we do have specialists hired that come in. And within our offices, I think there might be one coming in the northern part of our offices soon. But as I work in Parkersburg, and we're not gonna have anybody for ours, or like I don't think the other ones in the south yet.
Okay.
Um, but um, otherwise, it's just kind of just like referring out, just like by your feeling of things. Like if I mean, I do a lot of extractions, and I mean, as many like Aspen dental practices do, as I've talked to other doctors throughout the United States about this within Aspen, we do a lot of extractions, we do a lot of dentures, but when it comes to like if I don't want to do one, like I don't want to do a root canal that I feel like is going to be difficult, and we send it out, and there's no special person I have to send it to. It's just whoever's in
Awesome.
the area that we decide to send to.
No, that's awesome. Thank you. Um, so overall, with you being at Aspen, how do you feel about your benefits? Someone just asked via email.
My benefits,
Yes.
like, are we talking about like?
401k, healthcare.
Oh, it's something that you're not going to get with anything else that like I mean maybe I what is the DSO like is that the other like the other corporate I don't other places I have no idea what they offer obviously but as far as Aspen they're going to give you it's going to be the best like for like retirement and insurance like situation you can get yourself into in my opinion versus going private practice because I've done that and I don't really mind telling my personal experiences of going from spending $550 a month for health insurance to going to $135 a month in health insurance. I mean that's a pretty significant change in your I mean chunk of money a month and then being able to maybe instead of spending it on insurance and starting to put it into retirement for your future it's a lot I mean instead of just and the insurance that you receive through Aspen is better than you would get because the ones you buy through the health marketplace or whatever are not real hot, and the one I have now, it's pretty good. You know what I mean?
Yeah,
Like it's better because we're a corporation.
definitely. I will speak on my fiance, who is also a private practicing dentist, not because he could have joined Aspen, but he specializes in like sleep apnea and things like that. So we're not there yet, but I think we will be there one day. And when we are, I'm going to make him join Aspen, but we're not there yet. But he spends a ridiculous amount on healthcare insurance. And I'm like trying to speed up the marriage process so that he can pay less because he will be on my benefits because it's that much better. And same with the 401k, all that great stuff. Aspen Dental provides amazing like healthcare, vision, 401k, short-term disability, long-term disability, whatever it may be,
Mm,
maternity leave.
anything you need, I mean, they you can
Yeah,
get it. So some of this other stuff I've already had, but it's just like,
true.
but yeah, that was the other thing is that the kicker was I got vision on top of my health, and I was like, it was crazy. I don't know
Yeah,
because
so
it's just
like
you just don't get it in like the everyday, like
totally,
stuff you get online.
totally. Um, you know, a lot of new grads ask, what should they do next? Should I go into residency? Does Aspen provide enough support not to go into residency? How do you feel? I know you're an MTD, you didn't start with us as an associate, but now after 5 years of practicing, hindsight, what are you thinking with residency, working at a DSO, going to private practice? What are the next steps?
I think that I mean my true advice, if you don't feel prepared coming out of school, then there's no reason not to go to residency or like do a GPR. Or, I mean, or if you're obviously if you're going to specialize, go specialize, do whatever you want. But like if you feel like you need more practice, then go get it. Like, but at the same time, I think that you can leave, you can come out, and you're going to have support. I know. Honestly, if I think that my associate was a little daunted by the speed of Aspen because we do have we're a little higher like pace than whenever I went out into private practice.
Was she,
But
was she a fresh new grad?
mhm,
Okay, cool.
but she I feel that she it probably was a little daunting at first, but like we made we slowed things down, and we you know gave her more time, and then as time was went on, she's got faster and she's done better, and I mean she does great. It's just but like when you come out of school, like it's gonna be it could be an interest like a kind of an overwhelming experience at first at Aspen, but I think that we provide like we the way we do things like no one's going to expect like greatness out of you overnight or anything like
Totally.
so I think but I would still encourage if you don't feel prepared, then go get more practice. Like if you want to go get a GPR, go get a GPR. It's like not a bad idea.
Yeah, awesome. Cool. So I'm going to ask one last question. Oh, no, it's like another. Okay. Does Aspen prefer students who went through residency? Does it make you more competitive as a candidate? I'm, I don't know if you can speak for what you've seen in other offices or,
I honestly have for if they prefer residency or not.
yeah.
I honestly have I have no idea about that at all.
I'll,
Um,
I'll, I'll speak on that. So I've seen that those that go through residency, maybe they'll start as an MCD instead of an associate. So we kind of look at it as like a little bit more experience. So that would be the only difference. But that would make sense because you are getting another year to 2 years of experience. But again, with residency, you're not during that residency time, you're not making as much as you would starting right away as an associate with us. But there's no, um, we're not looking at you as being more competitive. It would just be a different role. You'll just have more responsibility,
I
I
think
would say.
I'd say it's the same thing as me being practiced for a few years versus coming out of school. But
Yeah.
like I think my main point really is that you can come to Aspen straight out of school, and I think that we have a good support team, and like between CE and like just how we do things, I think that you can like become very good very quickly, even though I mean it's a little overwhelming at first.
So this will be the last question. Besides like a general one I'll ask after this, but are there incentives/advantages to staying at Aspen for a long time? for you, you're here as an MCD. Do you have plans to be an owner? What are your future plans? Do you see an advantage with staying at Aspen?
Staying, I mean, obviously, we did just talk about benefits. That's one thing that you obviously, over time, for obviously for here longer, building retirement and things like that, or having insurance and et cetera. But then also there's opportunity to partner, or own practices. My aspiration is to partner at the practice that I'm in right now. But it's only been a short time, so I'm just not quite there yet. I don't think just ready to make that move. But we've certainly had the conversation already, and it's just one of those things that it provides you. Honestly, I mean, it's just a way for you to be more involved in your practice, but also you do. I mean, it's a way for you to make more money as well. Like, I mean, if you're a partner in the practice, you get to benefit from profits of the practice itself after the bottom line. So I mean, there's just good ways to move up. I mean, there's other options. It's not just you can just be an associate forever, or maybe you want to be an MCD after an associate, or if you want a partner, there's other options, or maybe you want to own one someday. Who knows? But there's obviously other things to do than just come and work. So
Oh, definitely. Thank you. So this isn't really a question, but I just want to see, do you have any last minute comments, advice for any, you know, first year students that are just so overwhelmed and can't see the light out of at the end of
the
the
first
tunnel,
year,
or for fourth year students that are, looking for their next step? Any last words, advice for A to Z, first year to fourth year?
first years, I mean, I know it's like the first couple years it is miserable, and it's very like looking back the 4 years totally like for both of you guys it's a one of the hardest times of your life to get through, like mentally and like emotionally, and it's draining. It's a like, but then afterwards, light at the end of the tunnel, you get out and man, it is so much better. So like just keep working, and like, I mean, and whatever you decide to do after this, I mean, as fourth years go, I mean, there's no bad choice. I mean, you picked a great profession. So, but if you want to be part of the Aspen team, I think it would be it's certainly a good choice also. So,
Awesome. Awesome. Thank you for that. And just so everyone knows, we're talking about the West Virginia area, be it where Dr. Gray is at, or, we have some offices closer to your campus. We're always open shadowing and just gaining that experience to really get to know what we're like. And, even if you don't choose us, it's really important to see what it's like to be in other offices, be it private practice or DSO. So feel free to shadow with one of us, contact me. I'll work with Dr. Gray, Dr. Cost, on getting that opportunity and everything. But other than that, we're going to conclude this AMA. Thank you for all the questions that everyone asked. If you have further questions, feel free to email me. And if you have them specifically for Dr. Gray, I'll forward them to him and he can reply to me, and I'll get in contact with you and answer all those. Just going to quickly say that the top 4 questions asked by everyone was Chad Love, Savannah Briner, Joyce Shong, and Hassan Akbar. So you guys are the winners of the top 4 questions, or top 4 people that asked the most questions. So congrats to you guys. Dr. Gray, anything else?
um, not really, but I mean,
Good.
if you want to, I mean, if you want to work for it's a good company. So I mean, it's always a good option. So
Awesome. Thank you, Dr. Gray. Thank you for taking your evening and taking an hour out of it to talk to us and talk to all these students. And we really appreciate it. And um, any other questions, feel free to email me. Other than that, good night, everyone.
thanks.
Thank you.